in your young dogs, in your young horses, you're really chasing your tail once you have a problem. And yes, we can now demonstrate that we can slow down that progression, but it would be great to not have the issue in the first place, or at least, delay the onset as long as possible.
Hello, VetFolio Voice listeners. Thanks so much for tuning back in. In this episode, I was joined by Alex Medved of Interpath Global to talk about a topic that's getting a lot of attention lately, and that's osteoarthritis. We know that osteoarthritis is progressive, and while it's manageable, it isn't curable. And now we know that it's not just a condition of older dogs, but something that can have profound effects in young dogs as well. All of this speaks to why multimodal management to ease clinical signs and slow down OA progression is so important. And in today's episode, we're diving into another tool we can add to our osteoarthritis toolbox and help our patients, and that is a product called Foresight Epiitalis Forte. Alex and I talked about the large number of studies looking at Epiitalis and its ability to reduce inflammation, improve radiographic signs of OA, and even show some promising signs of chondrocyte proliferation in vitro. And because joint disease can affect such a broad range of patients, we dove into how Epiitalis fits into the broader approach to supporting joint health in patients predisposed to osteoarthritis, to post-operative patients, and to those dealing with clinical osteoarthritis. It was a really interesting talk. Let me tell you a little bit about Alex, and we will get into it. Alexandra Medved is the National Sales and Global Technical Manager at Interpath Global, the makers of Foresight. She brings extensive expertise in animal health sales and strategic business development. With a strong background in equine and companion animal joint health solutions, Alexandra is dedicated to driving growth and awareness of osteoarthritis in companion and working animals by delivering innovative product solutions to veterinary professionals. A keen FEI-level dressage competitor and doxy mom, she combines her passion for performance horses and companion animals with her professional experience. She leads with a research-driven approach, ensuring Foresight remains a trusted choice on the market. All right, let's go ahead and get into our episode.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on VetFolio.com.
All right, well, I'm excited to be joined by Alex Medved. We're going to talk about Foresight when it comes to joint health, and this was kind of a new topic on my radar, at least. So, Alex, thank you so much for joining me.
My pleasure.
Yes, I understand it's we're kind of working across the globe here. It's very early over there.
Yes, you can probably detect an Australian twang. So it's 20 to 7 in the morning, which is not too bad. It's not too early.
Oh, we will just agree to disagree on that one. And I will just say I'm very thankful that you agreed to join us at this time, because I don't think anybody wants to hear from me at that time of the morning. All right, well, let's talk a little bit about Interpath Global, which, as I understand it, is kind of the company behind Foresight, which is what we're going to talk about a little bit more. Can you tell us about Interpath Global?
Yes, so Interpath Global is a family-owned business owned by Dan and Karina Brighton that started well over 25 years ago when their family dog started to show some symptoms of joint pain, and she was diagnosed with osteoarthritis. So Dan and Karina were the pioneers in the research around using marine-based ingredients, so in particular New Zealand greenlet mussel, for the treatment of joint pain. And they are Kiwis, they are from New Zealand. So we launched a product called Sasha's Blend many years ago, and now we're very much focused on our patented active, which is a plant-based product called Epiitalis.
And certainly green lip mussel would be something that, I'm familiar with in terms of joint supplements. Pretty, if I'm remembering correctly, kind of a powerful anti-inflammatory, right, that we're going for with the green lip mussel.
Yes, that's correct. And it's interesting how that was achieved. So it was actually originally being used in trials for cancer patients, and these patients
Oh.
reported improvements in joint pain. So that that was a bit of an unintended consequence. It's quite well known for its symptom modifying properties, so just reducing those clinical signs of joint pain.
Yes, yes. And now we see it very frequently in joint supplements and things like that. But, as you mentioned, kind of started there. And then now we're talking about a different compound, Epiitalis. Can you tell us a little bit more about that?
Yeah, absolutely. So Epiitalis is a patented active that powers our gel formulation. So foresight Epiitalis for dog and horse, and it's a proprietary extract from a plant seed.
Interesting. I feel like we're seeing more and more, and I guess it should really, whenever I think about this, I'm like, this is no surprise. I feel like we're seeing more and more, I guess actives would be a good word, whether it's in supplement form or in drug form, derived from plant-based sources. And again, whenever I say that out loud and I think about it, I'm like, well, of course, because where do we think our pharmaceuticals come from?
Yeah, yeah, absolutely. And there is an expression that food is medicine, but in many instances it is. So we know aspirin has come from a plant-based pentosan polysulfate, which I think is relatively new to the US. That's from the birch tree, I believe. Yeah, so Epiitalis is high in a very unique fatty acid. So these play a role in cell signaling as well as dietary purposes. So we've stumbled on a fairly unique one that we believe plays the role in signaling to chondrocytes, which are the cells in cartilage.
Right. And so I had the opportunity to chat with you about this briefly before we turned on the microphones here. And did I understand correctly in our conversation before, you're seeing chondrocyte proliferation with Epiitalis?
Yep, absolutely. So we have a number of peer-reviewed and published papers, both in vitro and in vivo in the living animal. And in one of our in vitro studies, we were wanting to essentially test the efficacy of our marine-based ingredients along with Epiitalis. And what we found was we conditioned these chondrocytes from the thoracic limbs of pigs, challenged them with or stimulated them with interleukin 1. And then we added simulated digests of our marine ingredients as well as Epiitalis just to see what would happen. And we found that in the Epiitalis group of those dishes, we could see, despite those cells being in a stressful environment with that inflammatory response, that they were not only thriving but continuing to divide. So that forms one of the basis of our patents with this product. We are testing that in the living animal, and we've obviously got a fair bit of work to do to be able to replicate that in the living joint, but that's where our research is heading.
Wow. And I mean, that would be a really big deal because, generally we think of cartilage as once it's gone, it's gone. And we're not regrowing cartilage. We can just kind of maintain as much healthy cartilage as we can. So, am I understanding you correctly that if it could be replicated and it could be demonstrated that this could be replicated in vivo, in the living joint, that potentially there would be opportunity to not only maintain healthy cartilage, but maybe even build healthy cartilage?
Yeah, absolutely. So we've been able to achieve something that no other joint supplement has been able to achieve with Epiitalis, and that's disease modifying properties. So, really by default, if your cartilage cells are not functioning, you're going to have that degradation of that cartilage matrix. We certainly don't say, we rebuild cartilage. There is no cure, as you say, for osteoarthritis. But, the first step to that is ensuring that the cartilage cells are functioning. So we are investing heavily looking at a cellular level, how Epiitalis works. But that's certainly on the radar. It's a huge market. All of the multinationals are investing huge amounts of money to really cure osteoarthritis, and it'll be who wins first.
Sure, sure. And I'm curious, because as you mentioned, at this point, we're not rebuilding healthy cartilage. We're just trying to help support those cartilage cells and keep as much healthy cartilage as possible. So, what sort of effect have you seen in vivo with this product? Like, what sort of clinical outcomes have you seen?
We're very much improving the symptoms. So we see animals that start on Epiitalis improve in their symptoms. So whether it be improvements in lameness. So we have a dog study where we looked at 46 dogs with osteoarthritis, and we used the gait right, which is a 5-meter mat that has pressure sensors every couple of inches. So we can measure the total pressure index of the limbs, and so we can identify which is the sorest of the limbs. Put them on Epiitalis for a month, and then retest that. And in one of our studies, we saw a significant improvement in the lameness scores of these dogs. So we can see from a symptom point of view. Then we just recently published a equine study out of Colorado State Uni, and that was led by Professor Wayne McElrath and Katie Seabow. And we were looking at the radiographs of horses. So this was a 70-day study. The horses had bone chips in the knee joints. Some were randomized to receive Epiitalis, the others placebo. And then we could assess these horses at the end of the study. And the Epiitalis treated horses had significant reductions in their total radiographic scores. And it was very, very obvious on X-ray, didn't need to be a radiographer, to see which horse had significant problems and which horse, if you were looking at a pre-purchase, you'd be like, oh yeah, I'm not running a mile. One of the biggest things in that study was that the Epiitalis treated horses either had no bone spurs or osteophyte formation, or very low grade. And that was really quite evident on the X-rays as well. So we can really see in that such a short study, we can really reduce the onset of osteoarthritis in an injured joint.
Wow. And yeah, to see radiographic changes, not just symptom related changes. If you're not seeing, I guess, regrowth or regeneration of chondrocytes, what do you attribute the improvement in clinical signs and radiographic score of osteoarthritis? Like where do you think that improvement is coming from?
So we know inflammation is good. We don't want to be completely blocking these inflammatory mediators because they're part of the healing process. So, unlike non-steroidals, which you'll obviously use in that acute phase, we don't want to be, blocking these COX pathways. So essentially, prostaglandin E2 production long term. But we know when you do have elevated inflammatory chemicals, that's when you do start to see over a long term, degradation of the joint structures. So as I mentioned, formation of those bone spurs. You start to see, decrease in the quality of the synovial fluid, so it loses its nice viscosity and slipperiness. And then, as we demonstrated in the pig cartilage study, that chronic elevation of inflammatory chemicals puts those cartilage cells under pressure. So sort of once you have the balance tipping away from healthy chondrocyte production, you start to see that cartilage matrix degrade over time. So we know in some of our other equine studies where we've looked at concentrations of prostaglandin E2 in the synovial joint fluid pre and post feeding Epiitalis, we can see in those horses we have significant reductions in prostaglandin E2, and that was one of the endpoints in the Colorado State Uni paper. So we measured prostaglandin E2 over the 70 days, and we could see it just went back to the baseline. It didn't go to zero. So we know that we're not blocking that production of inflammatory chemicals. We're merely just reducing it down to a more normal level.
So just to reiterate, if I'm understanding correctly, almost thinking of it like eustress and distress, where, like a little bit of the inflammatory mediators is good because that's facilitating healing, but long-term or higher levels of the inflammatory mediators would be problematic to these joints over time. So in this study, you saw reduction of prostaglandin E2, but not complete elimination of that. First question, did I understand correctly?
Yes, that's correct. Yes.
Wonderful. Yay, she can be taught. And then, second question, am I also understanding to say with NSAIDs, we're sort of eliminating those inflammatory mediators, like maybe seeing a much more dramatic reduction in those, which maybe over the long term might not be as beneficial?
Yeah, so there's obviously selective COX-1 and COX-2 inhibitors, but we certainly do see still some side effects that persist. So one of the positive roles of prostaglandin E2 is the maintenance of the gut mucosa, and obviously that's one of the side effects that we see with long-term use. Impacts on kidney functions. These products absolutely have a role, but they have a specific role in that sort of short-term or acute phase.
Absolutely. And I do remember that now that we're talking about it, that the COX-2, as much as we do want to target that for anti-inflammatory reasons, if we eliminate it completely, exactly to your point, that we do see issues in the gut and we need some COX-2 around for various functions in the body. And I certainly don't think anyone would argue to say, yes, if we have an alternative to long-term NSAIDs, then yes, let's talk about that, because if we don't have to do long-term NSAIDs, then all the better.
Yeah, absolutely. And in one of our dog studies, we actually didn't have a washout period for these dogs. So these dogs were diagnosed with OA. They were already on a range of, whether it be non-steroidals, injectables. I think there were a couple on, gabapentin. We left them on their current OA prescription medications and added in Epiitalis. And 71% of those dogs improved on both the total pressure index. So that was our good quality objective data. And we also use the Helsinki Chronic Pain Index as that subjective data collection method. So that was really good to see that with the addition of Epiitalis on these already well-managed dogs, we could see further improvements.
And I'm so glad you said that. That was actually going to be my next question, is if we are worried about reduction in prostaglandins and GI ulcers and things like this, is there any contraindication to using this product with NSAIDs?
No, not at all. And what we're certainly seeing over here in Australia is it just gives vets an additional tool in their toolbox. So if they're getting these dogs early enough, maybe when they're starting to be, showing sort of mild symptoms, add them on a product like Foresight Epiitalis Fort. And then we're giving them room, further down the line when the dog is quite elderly to then bring in other products. And we're seeing dogs that are on existing, particularly the non-steroidals, the owner and the vet can start to tinker with that dose to find that sweet spot of, maximum symptom relief, but minimum potential side effects. And in many cases, they've actually been able to remove that non-steroidal. And then they've got that for when they need it, whether there's breakthrough pain or the dog's been a hoon on the weekend and is a little bit sore. So it just gives vets and owners some additional flexibility.
Yes, and goodness knows with managing arthritis, especially as we're starting to pick up on it earlier and earlier in life, and really see these symptoms sooner. You're absolutely right. When we kind of max out our options there, it can be really problematic when we do have a dog who has a wild weekend and runs around like a lunatic and then is extra sore. But we're going, man, we can't go up on this NSAID dose, and we're already on all of these other medications. Pretty much rest is what we're left with in some of those cases. Obviously, there's other options. I won't, just completely say, oh, only rest. I know there's other things that can be done, but medication-wise, it can be really limiting. So I absolutely hear what you're saying, to get that NSAID dose down to kind of the minimal effective dose or removed entirely in an ideal situation. And then when we do have one of those wild weekends, then we have those in there a little bit more effective.
Yeah, absolutely. And we know managing arthritic patients, it's a multimodal approach. So we're looking at, nutrition to make sure that their weight is under control. We're looking at, adjunct therapy, whether that be things like hydrotherapy or massage or red light. There's obviously a role for some of the newer technology in terms of the pain receptor mechanism, but then having a product that actually has disease modifying properties. So we're dealing with the pathology within the joint alongside all of these other things that we can do to help the patient as well.
Sure, sure. And you mentioned, kind of if we can catch these in the early stage and then also giving us options as these animals get older. What have the studies shown when it comes to using this product preventatively? Sometimes we'll do fish oils or other joint supplements early and a breed that's very prone to osteoarthritis or something like that. Any studies on using this preventatively?
Preventative trials are really difficult because they have to be really, really long in terms of years to compare two different groups. And then you've got all sorts of confounding factors. But that's where that CSU, the Colorado State Uni paper, came into it, because we could demonstrate, well, here's a injured joint and look what we can achieve within 70 days. So we can make some assumptions in terms of if we reduce that chronic inflammation, then we can reduce the onset of osteoarthritis. One of my horses it's N=1, but she is 15 this year. I've had her since she was 4. And she's been on Epiitalis every day, and she is small to her. So she's a Crescent Georgian to 1 horse. And we x-ray her every 12 months. And my vet's always like, well, Epiitalis is working because the joints look great.
Well, I think that's a good testimonial there. One, it's an N of 1, but that's okay.
Yeah.
1, she's doing great. And then 2, hearing your excitement and the research that's gone into this product, that you're using this regularly in your own horse, I think that speaks volumes as well.
Yeah, absolutely. I mean, people always ask, oh, what age should we start using Epiitalis? And if you can afford it, in your young dogs, in your young horses, because, you're really chasing your tail once you have a problem. And yes, we can now demonstrate that we can slow down that progression, but it would be great to not have the issue in the first place, or at least, delay the onset as long as possible.
Absolutely. And then speaking of using it in a damaged, I'm also curious about acutely damaged joints. So say like post-operatively in a TPLO or something like that. Any data there?
That's something that we're working on, but it's certainly something that the Australian vets have taken on with a lot of enthusiasm. So a lot of the dogs in Australia will have their cruciate surgery and then they go home, obviously, with their acute pain medication, but also with a bottle of Epiitalis as part of the discharge notes, because we know that if there's not arthritis in that knee joint, then it's likely to progress. And in many of these cases, there's bilateral lesions as well. So if we can get that dog feeling really comfortable as quickly as possible, equal weight bearing on those legs as quickly as possible, and then it's a really easy way to feed the dog. It tastes great. When we do our technical training here in Australia, the deal is the vets have to taste it. It tastes of pancake mix. So it's a very easy product to administer. It's a gel. It's 0.5 ml per 10 kilos, and you can just feed it straight to the dogs out of the syringe, and they really love it. They take it as a treat. So from an owner's point of view and an owner compliance, it's much nicer to be giving your horse or your dog a daily treat rather than, chasing them around the house and having to stuff a tablet down their throat, or finding, powders that have been sifted out of feeds. So we really want to make sure that the owners are comfortable and happy giving the product as well.
Yeah, if it's a fight every day, then that's a recipe for non-compliance. It's not going to happen at that point. And unfortunately, in those cases, those can be the ones where sometimes we do end up more dependent on the pharmaceuticals as opposed to supplements and things like that, and we can run out of options quicker. So yes, palatability, huge deal, and I don't think anyone would argue with pancake mix.
No. And we do have a cat version. So we have Foresight Epiitalis for cat here in Australia. And at one of the cat shows, one of our reps came across a couple who were using a capsule product, and their process every day was for the husband to get the oven mitts on, grab the cat. And this was they were thrilled about our product because the cats actually like the taste, and those sorts of things affect the relationship between the pet and the owner. And for the owner, that's more important than anything, really.
Yeah, I mean, I think that's a big deal when it comes to longevity, right? Because we worry about maybe running out of options for treatment, and then if we have a painful animal and we're losing quality of life, that can be an issue for euthanasia, and certainly that becomes the case if we can't treat the animal. So
yeah, exactly.
So yes, yeah, I can't imagine having to hold my cat with oven mitts. Oh, poor cat, poor owners. I'm so glad that they have another solution now.
Yeah, exactly. So the dog product tastes great. It's that cream flavor, and the horses love it as well. So the Foresight Epiitalis Sport horse is an apple flavor. Again, as owners, if we're often pasting a horse, it's probably a wormer, or it's probably a not very nice tasting antibiotic, and the horses can object, if you're wanting to stick something in their mouth. But when they get Foresight Epiitalis Sport horse every day, they really look forward to it. So that when you do your fecal egg test and it's time for worming, you can get that wormer in really, really easily. So we always have a joke with the worming companies that we make their customers happy.
There you go. Yes. The horse is much more willing to say, okay, I'm interested in what you have, rather than get that away from me.
Yeah.
Oh, and that's the worst, trying to fight with your horse to get something in their mouth when they don't want it. They have opinions, and it's hard to argue with them.
Yeah, exactly.
So we talked about prostaglandin E2 as one of the inflammatory mediators that's modified by administration of Epiitalis. Are there any additional cytokines that this targets that you're aware of, and in terms of their effect on inflammation and joint degeneration?
Prostaglandin E2 is the main one that we've studied. In the pig cartilage study, we did look at nitric oxide as well, and it had a significant reduction on that one as well. But in terms of studying the horses, where we use horses primarily because we can take a reasonable volume of synovial fluid out of the knee joint, and that would be very difficult to do in dogs. And that's the main inflammatory chemical that we've studied in horses.
Sure. And so you're saying primarily studied in horses due to the volume of synovial fluid you would have to take to assess these?
Yes, that's correct. And from my understanding is horses don't really secrete a significant amounts of nitric oxide. So we wouldn't necessarily see, those significant changes in concentration.
That makes sense. That makes sense. And certainly, prostaglandin E being a huge inflammatory mediator when we're talking about osteoarthritis and such.
Correct. Yes.
Well, this sounds really exciting. And kind of like we've talked about here, any additional option to help manage these chronic inflammatory conditions, certainly osteoarthritis, many of us are looking for as many options as we can get. It sounds like there's been a lot of research that's gone into this already. What sort of research goals are there for the future?
Yeah, so we know Epiitalis is a unique fatty acid, and we know that fatty acids play multiple roles in the body. One of which is a cell signaling mechanism. So our research is really focused around there, just to see the specific mode of action. So how is this actually working? Which molecule is responsible for that mechanism? That's certainly where we're heading, and I do believe we've had some pretty positive results recently. So that's given us a lot of confidence to continue going down that path.
Yeah, if kind of the nitty gritty of it can be elucidated there, the specific molecule, the cell signaling mechanism, then, who knows where that could go next in terms of keeping different cell lines healthy and happy and working in chronic inflammation.
Yep, we're very excited.
Yeah, very cool. Well, Alex, this has been great. I really appreciate you joining me again. Appreciate your early morning here. Kind of parting here, I would wonder, where can people find more about Foresight Epiitalis, professionals who are interested in learning more or want to try the product out? And are there any, final thoughts you want to leave us with?
Yep, certainly. So for vets, our products are available through Covetrus, or check with your preferred wholesaler. And for consumers, our equine product is through SmartPack, and our canine, so Foresight Epiitalis Fort Dog, through Amazon.
Easy to get a hold of then. And then what about the research papers and some of that you were talking about? Are those kind of open source available?
Yes, so if vets want to find more information, they can go to our website, which is just foresight.global, and there is plenty of information on the site regarding the research around the product.
And it's Foresight, the number 4?
Number 4. So number 4, because it has 4 different modes of action, and sight being a chondrocyte.
I like it. I like it. Well, yes, again, thank you so much. Any final thoughts you want to leave us with?
No. We're just excited that our little product from down under has finally reached America. So we're super happy to see the product out there and have a whole new market of people who will be coming back and telling us amazing stories that we hear regularly here in Australia. So yeah, we're super excited to see how it goes.
All right, I want to say a huge thank you to InnerPath Global for making this episode possible. Alex, thank you for all the fantastic information. And of course, thank you to everyone who tuned in to listen to this episode. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. If you want to find more episodes like this, you can click the education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts, your ideas for future episodes, so absolutely feel free to reach out to me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM or follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.